This is the story of a 32 years old female currently suffering from depression, or rather claims to be suffering from depression because she has not gotten a formal diagnosis. But according to her, she says, I wake up every morning with a heavy feeling in my chest, as if a dark cloud is looming over me. It's been like this for months now. I used to be a lively person, always ready to take on the day. But now, even getting out of bed feels like an impossible task. I try to talk to my family about how I've been feeling, hoping they would understand and support me. But instead of empathy, I was met with dismissive comments like, just snap out of it, or you are overreacting. They don't seem to understand that depression is not something I can just shake off. Their lack of understanding and support has made things worse. I feel isolated and alone, like no one understands what I'm going through. I've started withdrawing from social activities and even from my family because I feel like a burden to them. I wish they would educate themselves about depression and try to be more supportive. Just a little understanding and compassion could make a world of difference to me. Instead, their ignorance has deepened my sense of hopelessness and despair. I feel like I am drowning in my own thoughts with no lifeline in sight. Please, Ma, how can I educate my family members about depression, the signs, and how to support a relative dealing with depression? Thank you so much for sending in this story. I understand that it is not always easy to talk about mental health challenges, and I commend your step in doing this. And thank you for giving me consent to also share this story with my subscribers, just so that everybody can learn. Now, how can family members help someone suffering from depression? To be able to help someone suffering from depression, you have to know what depression is, at least know the symptoms. In this episode, I would highlight symptoms of depression and then suggest ways that family members can help their relations dealing with depression live a more successful life. One of the common symptoms of depression is persistent sadness, where you are feeling sad, hopeless, and empty almost every day. People also report loss of interest in activities that they previously enjoy. So you find people lose interest in hobbies, in their career, in family life. These are things that people would normally enjoy. Somebody can tell you, "Oh, I used to love to read books, but now I don't even want to see the sight of books." Another person could say, "I used to love movies, and now I don't even want to watch movies anymore." Somebody can say, "Oh, I used to love my job. I used to enjoy going to work, and now I don't even want to think about it anymore." Those are the kinds of examples you will find in somebody who has lost interest in activities they used to enjoy. Sleep disturbance is another symptom you will find, where people begin to sleep excessively or have difficulty sleeping. When you find this in a relation or a family member or a friend or a loved one, please do encourage them to reach out to a mental health professional or a healthcare provider. You can also leave a comment in this post and we'll find a way to reach you, because we all need help. We all need support. One of the symptoms you will find is fatigue or loss of energy, where they are always constantly complaining of being tired. They wake up in the morning and do not feel like coming out of bed. I had a client, 42 years old female, who reported that she would just wake up in the morning and all she does is watch her children go about their activities because she's unable to get up to support them. Some people can tell you, "I know I need to get to work. I know I need to be dressing up right now, but I don't even have the ability or the motivation to get out of bed." People can begin to feel such level of fatigue and low energy. And then feelings of worthlessness or guilt, where you are constantly asking yourself, "Who am I? What am I doing here? Why am I not enough? Why am I not achieving enough?" Many clients would even feel like they have become a burden to family members, like this person I talked about, where she talked about feeling like she has become a burden to her family members. And it's not always surprising when somebody gets to that stage of feeling like a burden, they might also begin to feel suicidal, where they just feel like, let me die, let me kill myself so that these people who I have become a burden to can live a better, a happier life. That is the rationale they give to themselves. Meanwhile, it's not true. There's really no need for you to get to the point of becoming suicidal and then actually actionizing it when you can actually find help. You can find help with psychiatrists, clinical psychologists, mental health hospitals are around us. If you find yourself in this situation where you are beginning to feel like there's a need for you to depart from this world because you are a burden to others, please reach out to professionals who can help you. You can also leave a comment in this post and then we'll find a way to reach you. If you are watching and you know somebody that is experiencing these symptoms, please also reach out. We all need help at one point or the other. Another symptom one would experience is difficulty concentrating. Have you ever been in that situation where you walk into a room looking for something and then you ask yourself, why did I come to this room? What was I looking for? And then for 5 seconds, 10 seconds, you are just standing thinking, it has happened to me and it happened to lots of people too. So if this has happened to you, it might be a time for you to begin to evaluate your mental health. Are you overworking? Are you overstressing? Are you overthinking? It's something causing you to become forgetful and lose concentration. Okay, so that can be one of the symptoms of a mental health challenge, in this case, depression. Now, I'm not saying just because you are forgetful means that you are depressed. No, I'm saying that some of these symptoms I am listing are things you would find in someone who is depressed, but you still need to go to the hospital, speak to a mental health professional, a psychiatrist or a psychologist, and get a proper diagnosis. There are also physical symptoms where you feel like your bones hurt, your stomach is constantly hurting you, you have leg pain, you have neck pain. Some people report that they have sensations around the back of their head that they cannot explain. This can also be signs of depression. Many people also report digestive problem. They eat and either they begin to constipate or they begin to have diarrhea. It can also be one of the symptoms of depression. One can also experience agitation or restlessness, or both, where you feel restless, you feel irritable, and have trouble sitting still. You just, for no reason, somebody says something and you have picked up, you have become very, very offended or angry. Sometimes it might be an indication that such a person needs some form of assessment or evaluation to determine what's wrong. Please note that these symptoms are not indicative that you outrightly have depression or a mental health challenge. But if you have more than two and it becomes persistent to the point that it affects your daily life, please seek the support of a mental health professional who would be able to assess you and create an appropriate treatment plan for you in the event that you do get a diagnosis for depression. So, how should family members respond and help somebody who have symptoms suggestive of a mental health challenge? The first thing is to get education. You cannot respond appropriately to something you do not know. So if a family member comes to you and says, oh, I'm feeling so tired, I'm feeling so weak, you might naturally interpret it as laziness. But if you know what the symptoms of depression are, as I have highlighted before, you would be able to pick up these symptoms among family members. And then that is the only time you can appropriately respond, because you now know what they are having to deal with. So you need education. You need to read more, you need to enlighten yourself more, you need to know what it is so you know what to do about it. Then you have to learn to listen without judgment. Apart from the fact that you are dealing with somebody who probably has a mental health challenge, all right, even in our daily life, in our daily relationship with family members, friends, and co-workers, everyone is encouraged to learn to listen without judgment, because sometimes somebody just wants to unburden themselves on you. Somebody just wants to tell you what is going on with them, and they do not want you to tell them what they have done wrong and how they should have acted better. They just want you to empathize with them. So it's important that even when you are dealing with people who have mental health challenges, learn to be empathic, learn to listen without being judgmental, and learn to, prefer solutions if you can, or appear to be that person who is trying to help them get help. Then if you can, offer practical support. You could suggest, oh, since you are not feeling like getting out of bed this morning, it's okay, I'll help you do the school run. or it's okay, I'll help you make breakfast, or it's okay, I'll help you prepare the children for school. Find a way you can support them. Most importantly, encourage them to seek professional help. You can be a very nice auntie, a very nice uncle, nice father, nice mother, nice brother, sister, niece or nephew. But if you are not a trained psychiatrist or a psychologist, you might not know what you should do for this person. So encourage them to seek professional support. You also have to learn to be patient with them. Sometimes our expectations at work are what causes us problems. You have a relation who is suffering from depression or any form of mental health challenge, and they are currently in treatment. That doesn't automatically mean that they are going to jump back into their daily routine. They might need time to be able to, ease back into life as they used to know it. So you need to learn to be patient with them. You also have to stay connected. Don't just suggest that they see a mental health professional and then forget about the matter. I understand that in Africa, especially in Nigeria, we really don't like talking about mental health challenges amongst family members. We just want to act like it's not there. But we need to begin to demystify this whole mystery around mental health. So if your family is currently in treatment, have a conversation about it. How are you doing? What's your medication? How is the medication working for you? What other help or support do you think you will be needing? Have a conversation about it from time to time. Stay connected. Don't just provide treatment solution and then walk away. Then avoid making assumptions. Everything is not mental health challenge. So, I've had cases where clients come to me and say, oh, I was watching a cartoon and I was laughing excessively. And my mother felt like, oh, it is a mental health condition. Doctor, can't I laugh again? So please, everything is not a mental health condition. Especially for those who have a diagnosis of a mental health condition, everything is not a mental health condition. If you're watching a cartoon movie and it is funny, of course you will laugh. Just laughing alone is not an indication that they are having a relapse. So do not make assumptions. Lying in the bed in the morning and not wanting to do anything might not also be an indication that, oh, this person is having a relapse. Ask questions, have conversation, all right, before you jump to conclusion that everything they do is a mental health challenge. I will encourage you as a family member to also learn to take care of yourself. It can be a big burden of family members who are caring for relatives with a mental health challenge. Don't also neglect yourself. Don't also forget to take care of yourself because your mental health matters too. Please don't forget to like, comment, and share this video. And like I will always say, if you or a relation or a friend or a work colleague are experiencing symptoms suggestive of a mental health challenge, please reach out to a mental health professional, reach out to a healthcare provider. You can also comment on this post and we'll find a way to reach you. Until we see you next time, I remain Dr. Aria.